Ectopic pregnancy. Ectopic pregnancy is essentially the implantation of a fertilized egg into an area of the reproductive tract that is not viable for growth and normal pregnancy, anywhere outside of the uterine cavity. This is often referred to as a tubal pregnancy and comprises 98% of all ectopic pregnancies. Less common locations of implantation include the ovary, cervix, and interstitium of the abdomen. Many studies have been done to prove the following risk factors have been associated with ectopic pregnancy. Management of ectopic pregnancy depends on several factors that will be explained in the next few slides. The most common presenting symptoms of ectopic pregnancy are vaginal bleeding and abdominal pain. It is important to distinguish this type of abdominal pain from other causes of acute abdomen, such as appendicitis or pelvic inflammatory disease. Abdominal pain associated with ectopic pregnancy will oftentimes favor one side or the other. While taking the history, patient may mention that she had a positive at-home pregnancy test. This should be a red flag to point you to the suspicion of ectopic pregnancy. Cervical motion tenderness, adnexal tenderness, abdominal tenderness, and bleeding are common physical exam findings. Patient may have a positive urine pregnancy test or elevated HCG levels with no sign of intrauterine pregnancy via ultrasound. To determine the location of the gestational sac, the healthcare team will routinely use low-frequency transabdominal sonography, TAS, or high-frequency transvaginal sonography, TVS. Studies have been done that prove MRI can be helpful in diagnosing ectopic pregnancy as well as determining exact location. Findings on MRI include tubal dilation, bloody ascites, and tubal wall enhancement. The optimal candidates for methotrexate treatment of ectopic pregnancy are hemodynamically stable, willing and able to comply with post-treatment follow-up, have an HCG concentration of less than 5,000, and no fetal cardiac activity. Methotrexate is a folic acid antagonist widely used for treatment of cancer, severe cirrhosis, and rheumatoid arthritis. It inhibits DNA synthesis and cell reproduction, primarily in active proliferating cells such as malignant cells, trophoblasts, and fetal cells. Salpingostomy is the removal of a portion of the fallopian tube. Salpingectomy is the removal of the entire affected fallopian tube. Salpingectomy is the procedure of choice if the fallopian tube is ruptured or otherwise disrupted, bleeding is uncontrolled, or the fetal sac is too large to remove with salpingostomy.